Our study looked at the status of behavioral health training in pediatric residency programs based on the perceptions of pediatric residency program training directors. We did this study because a large percentage of children and adolescents with behavioral health problems first present in pediatric primary care. In addition, effective prevention and treatment of behavioral health problems has a positive impact on patient physical health and general well-being. When primary care physicians refer behavioral health problems out to external providers, fewer than half of these patients make it to a first appointment. Most pediatricians believe they have inadequate training in addressing behavioral health problems. In 2006, 85% of pediatric residency program directors reported that behavioral health training in their programs was minimal or suboptimal.
We wanted to get a current assessment of innovations in training that are occurring, as well as barriers and facilitators when implementing those innovations. We were also interested in the effect that interprofessional collaboration with behavioral health providers, psychologists, social workers, had on perceptions of training. We looked at results in two facets: how directors perceived the quality of behavioral health training within the DBP rotation specifically, and how directors perceive the quality of behavioral health training outside of the DBP rotation, so across the curriculum. About 63% of directors rated behavioral health training within their DBP rotation as optimal. An interesting aspect of this data was that programs that had a psychologist serving as supervising faculty for residents on the DBP rotation were actually more likely to rate their behavioral health training as optimal, compared to programs that did not have a psychologist serving on the training faculty. When looking at behavioral health training outside of the DBP rotation, only 36% of directors rated this training as optimal, which speaks to the need to improve training by providing behavioral health opportunities throughout all aspects of residency, rather than relying too much on the DBP rotation. Fortunately, it looks like there are many innovative and beneficial initiatives that are happening in training across the nation, from standardized patients to enhanced didactics, case conferences, Schwartz Center rounds, computer-based learning to integrated care. Regarding integrated care, almost 60% of programs reported having on-site or embedded behavioral health providers, psychologists, social workers, counselors, and also psychiatrists working with residents in their continuity clinic, where they share patient care in a number of ways, including through warm handoffs and curbside consults. This really appeared to be a key contributor to facilitating learning enhancement for the residents.
Through qualitative data, we also looked at barriers and facilitators for behavioral health training. We learned that instructional content on behavioral health issues, such as assessment, ADHD, mental health problems, and common factor strategies, should be enhanced. We learned that training modalities tend to involve relatively passive methods, such as shadowing and observing. Residency directors think there is not enough use of active participation and hands-on experiences. Faculty members were seen as both a barrier and a facilitator to behavioral health training. Some programs had faculty who were expert and enthusiastic. However, lack of adequate numbers of such faculty and the difficulty of recruiting them was cited. Stakeholder support was also seen as a barrier, as some faculty, department chairs, and other administrators do not support the importance or financial viability of integrated behavioral health care. Over the past decade, there has been substantial improvement in pediatric residency training in behavioral health. We concluded that additional improvement is needed. Efforts to improve training should focus on enhancing training content, improving training methods, developing stakeholder support, and enhancing instructional resources.